Forward-facing nostril piercings, also known as Mantis piercings. Average healing time, 6 to 12 months. Keep your jewelry in for the entire healing time. Do not remove it to clean or change it. If you would like to change out your jewelry while your piercing is healing, we can change it for you. Jewelry worn in a healing piercings needs to meet very specific requirements, so we cannot change it to outside jewelry while your piercing is healing. We will also want to wait until it is completely healed before changing it to a hoop. When we first pierce you, your jewelry will be extra long to allow room for swelling. If there wasn't room for swelling, it could overswell and pull one end of the jewelry inside of the piercing channel, which we certainly don't want to have happen. With the extra long jewelry, it will be annoying at first, but once it swells, it will fit much nicer. Once the piercing de-swells, the jewelry will be long and annoying again. When this happens, we strongly recommend scheduling a jewelry downsize appointment so that we can switch the jewelry out to a shorter post. We only switch out the bar that goes through the piercing channel when doing this, and we put whatever ends you originally purchased back onto the shorter bar. This will help the piercing heal better and will look much nicer. If you leave the long bars in after a piercing is no longer swollen, they can get snagged, bumped, and move around a lot, which can lead to complications healing. Forward-facing nostril piercings are typically ready to be downsized to a shorter bar about 1 to 3 months after being pierced. To clean your piercing, we recommend cleaning it with sterile wound wash saline and clean water. Ingredients in the sterile wound wash saline spray should only include sodium chloride and water. Let the shower water hit your piercing on each side for a solid minute at the end of every shower. This is the best way to remove crusties and buildup around a healing piercing. With the sterile wound wash saline spray, spray each side of your piercing once to twice a day. We recommend using the sterile wound wash saline for the first few months, and once the piercing calms down, you can switch to using just water. You can still use the sterile wound wash saline spray on days where you skip showering or if your piercing starts to flare up. Gently pat your piercing dry after spraying it with water or saline using a clean single-use tissue to absorb any leftover moisture, since too much moisture can sometimes lead to healing complications. We do sell sterile wound wash saline at our studio if you would like to purchase some at the time of your appointment. The ones we sell have a fine mist spray, which we highly recommend as they last much longer and are much more pleasant on your piercing than full-stream sterile wound wash saline sprays. We do not recommend cleaning your piercings with Q-tips. Q-tips tend to knock a healing piercing around too much and leave fuzzies on the piercing that can get stuck in the piercing channel, both of which can cause healing complications. Do not use any other products on your healing piercing. This includes alcohol, hydrogen peroxide, Bactine, Neosporin, soap, homemade salt and water solutions, tea tree oil, etc. None of these are recommended for long-term wound care and can all lead to healing complications. Be careful of facial products and be sure to not get them in or on your healing piercing. This includes makeup, lotions, face wash, etc. If you think you may have gotten any of these on it, be sure to rinse it well immediately afterwards with water or sterile wound wash saline. Do not twist, move, or play with your healing piercing. If you have heard to twist your healing piercings before, it is an old myth and is very bad for it. The less you touch your healing piercing, the better. If you ever do have to touch your healing piercing, be sure to first thoroughly wash your hands with hot water and soap to avoid infection. The easiest way to get an infection in a healing piercing is by touching it with dirty hands. You also want to make sure that everything that comes into contact with your healing piercing is clean. This includes pillows and other bedding. You should keep your healing piercing out of unhygienic bodies of water to help avoid infection. This includes swimming pools, hot tubs, lakes, oceans, rivers, etc. The more healed your piercing is, the less likely it is to get infected, but if it is still healing, there will still be some risk of infection if exposed to bacteria. Some water also carries more risk of infection than others. Natural bodies of water such as lakes, oceans, and rivers carry the most risk, since this is where a lot of the really scary bacteria tend to live. We would recommend being extra cautious around them with a healing piercing. Swimming pools and hot tubs have chemicals in them that help kill some of the bacteria, making them less risky. These chemicals don't kill all of the bacteria though, so there is still some risk, and the chemicals themselves can also irritate a healing piercing. When you first get pierced, your piercing will look pretty imperfect since it hasn't had a chance to get mad yet. Over the first few weeks, it will start to look more and more like a healing piercing. Things you can expect to see with your healing piercing are some minor redness, minor swelling, small amounts of clear, white, or tinged yellowish goopy discharge that will dry and crust on there, and minor pain and tenderness. Some minor spotting from your piercing can be normal as well. These will eventually become less and less until the piercing is healed and it looks like a pretty and perfect piercing again. The best way to tell if a piercing is healed is all goopy discharge and crustiness will go away, along with all pain and tenderness. If your piercing is still forming crusties on it or flares up from time to time, it is still healing. What would not be normal is if your piercing is extremely red, extremely swollen, such as to the point that the jewelry is putting pressure on the skin, large amounts of goopy discharge, especially if it is a dark yellow, greenish, or chunky, or extreme pain and tenderness that does not subside after a few hours. These can be symptoms of an infection. If you suspect an infection at any point, you should speak to a licensed medical professional as soon as possible. You should also reach out to us since your piercing may require an extra long bar to compensate for the excessive swelling. If you ever aren't sure if something is normal or not, please reach out to us. While we are not medical professionals, we deal with piercings on a daily basis and are always happy to help out and let you know if something looks okay or not. We are also able to help troubleshoot minor piercing complications. Most piercing complications that may occur tend to not be too serious. The most common piercing complication that we see are people forming a small irritation bump on their healing piercing. These mostly form on cartilage piercings, which includes nostrils. As the name suggests, these typically form from something irritating the piercing. Things that can irritate a healing piercing include harsh products, playing with the piercing, using Q-tips, bumping, and snagging the piercing. Getting your jewelry downsized once the swelling subsides helps prevent a lot of this potential irritation. These small bumps are typically nothing to worry over and almost always go away when treated right. If you end up forming an irritation bump on your healing piercing, reach out to us and we can troubleshoot it with you to help get it to go away.